In therapeutic recreation, what we are always looking at is capitalizing on our patients' interests and passions, and what that usually or ultimately leads to is helping them find healthy time use. We modify, we adapt those activities, or we provide resources in the community for them to participate in the activities that they want to do. First and foremost, it's very important that a child and any family in this situation sticks with the schedule as normal as possible. Waking up at the same time they would normally wake up on a typical school day, getting dressed just as they would and not staying in their pajamas, eating breakfast, and then planning out the day with their siblings, their family, so that everyone kind of knows what to expect, what the day might look like, and everyone can have a piece of that planning together. Schedules are really important, especially as children in particular, they thrive on routine.
We want to make sure that kids of all abilities feel that they can be successful at home and with a new routine and structure, mimicking what they're used to in their typical day. We want to provide opportunities and activities that can be done at home with things you already have at home, maybe in your bedroom, in your closet, in your garage, and show them how you can adapt and modify these really simple and fun activities and incorporate it into their daily schedule.
It all takes a little bit of creativity, some willing participants, and some imagination.
Certainly there's going to be a little bit of that socialization piece missing potentially, but depending on who's home with them at the time, they can absolutely get a classroom stimulating environment set up with the right supports in place.
There's a lot of things that our parents can do. Some things that may come to mind naturally, like on a weekend day, incorporate them in cooking. Have them help with all 3 meals and with snack time too. Might be a good time to practice doing laundry or setting the table. All of those kind of home chore learning activities are vital for kids. Secondly, if they do have access to the curriculum that their child might be learning in school, hopefully get a copy of that if you don't already have one, or looking at the child's, if they're on a 504 plan, IEP, kind of reminding themselves what their goals are for the year and trying to work on academic skills for their age and also based on their ability.
I think parents are absolutely capable of learning a little bit from what we're going to demonstrate, but also from each other. You know, we want to encourage this time of sharing and supporting each other and knowledge. Hey, what are you doing at home with your kid? What can I learn from you? How did you adapt this?
So talk, sing, read, write, play are 5 basic principles that help a child be ready to learn. So you're going to be talking about what you're doing, you're going to be reading, writing, so looking at what you're actually learning. Singing is a really vital way to learn new information and to retain it as well. And then play. We know through many, many studies that children learn best through play. So actually doing it, having fun with it, learning from mistakes. They don't have to play perfectly, and that's part of the fun of it.
You can mesh perfectly a little bit of learning and critical thinking skills, but with that play in there so it's still entertaining and engaging for the children. We're going to keep doing what we do best, and that's helping spread the knowledge, resources, and education on how you can still have leisure at home and still help your child achieve goals of growth, development, physical ability, critical thinking skills, all with activities and ways to modify it right in your own home.
So we'll be showing you a variety of demonstrations of leisure activities we hope that kids will have fun doing. Along with that, we will be incorporating academic skills, so showing different adaptations, modifications for different types of abilities, capitalizing on what our kids can do, and learning along with just having fun at home.
We want to make sure our patients know that we encourage play at all ages, so the activities we're demonstrating can be accommodated for kids all the way through adults and everyone in between. Play is great for everybody, especially when we won't be in our regular routines and activities, so we want to make sure everyone joins in with these and tries them at their level.